Andy Johnson, Minnesota State University, part 7 in our series of mental health related to children and adolescents. This is related to suicide. Now, DSM-IV does not identify suicide as a mental disorder. However, it is often directly linked to mental health disorders, most commonly depression. It is the third leading cause of death of people ages 15 to 24. Of college students, it is the second leading cause of death, preceded only by accidents. So it is very serious, something we must consider. And before the age of 12 or the onset of puberty, suicide is rare. By the way, if a child commits suicide in a school, we call in the mental health experts to help the children deal with it. My idea or my passion is that why don't we do it before the child commits suicide instead of simply reacting? Let's be proactive in our mental health issues. And that's why the last series of videos will look at promoting mental health. It's not enough just to be reactive. We have to be proactive. Off on a tangent, but girls are twice as likely as boys to attempt suicide, but boys are 4 times more likely to exceed it. Students who are gay, lesbian, bisexual, or transgender are significantly more likely to attempt suicide. 21.5 versus 4.2. Why is this? Is because the social environment for adolescents who are GLBT is significantly worse or more adverse. All right. The best predictor of suicide, of course, is previous attempts at suicide, followed by depression that's accompanied by feelings of strong helplessness and strong hopelessness. These are the best predictors of adolescent suicide. Some of the risk factors associated with it: the psychopathological or psychopathology, depression, drug abuse, anger, impulsive behavior, pessimism, conduct disorder, panic disorder. The environment, availability of firearms, diminished family cohesion, negative life events, child sex abuse, suicide contagion, meaning there's a lot of it going around. Previous suicide attempts, as we said before, and same-sex sexual orientation. Warning signs: withdrawal from relationships, from friends or classroom and school activities, depression, boredom, lack of interest in school, an abrupt decline in the quality of homework, talking about death, the hereafter, or suicide, giving away prized possessions, drug or alcohol abuse, personality change, rise in anger, boredom, or apathy. Comments about suicide as a solution: unusual neglect of appearance, radical changes in personality, difficult concentrating, staying away from school, complaints of physical problems, changes in eating and sleeping habits. I have some activities and mini lessons related to preventing mental health issues at the website.